Why do we take x-rays? X-rays are an extremely simple, beneficial tool that's readily available that can get us a lot of information that's going to help us to dictate what we need to do in terms of your clinical outcome, as well as what we need to do in order to set up the best treatment plan for you. There's a chart behind me that shows different stages of degeneration. Depending on what people's chief complaints are is going to determine on what tests that we do on if we think x-rays are necessary. And if we find degenerative changes, it will impact what our recommendations are going to be, whether it's the frequency of the adjustments, whether it's the types of adjustments that we give, or whether it's the best exercises that we're going to recommend in our rehab area. If somebody comes in with a normal spine, no signs of degeneration, disc space is healthy, really, really rare to have a pressure or direct pressure on the nerves, that person's going to get a different care plan than somebody who comes in with stage 2 degeneration, which builds up over a period of 5 to 10 years. And that's going to limit how the person's spine is going to move. That's going to limit the improvements that we're going to see in a short amount of time. We are going to have to go through more of a breakdown phase with the person in stage 2 degeneration, because we need to try to influence as much movement as we can, break up some of the scar tissue, break up some of the adhesions, relieve pressure off the nerves before that person's going to see some response. So somebody with stage 2 degeneration, we're going to have to set different expectations and different treatment recommendations and goals than somebody with stage 1 or no degenerative findings. Not only that, stage 3 is something that you can progress to, and truthfully, that's more of a surgical consult at that time. Degeneration's gotten to a point where the body's almost fusing itself together, and we might want to refer out to an orthopedist or neurologist. So x-rays are extremely beneficial. They're going to give us as much information as we can on the true nature, the true structure of the spine, how it might be correlated to the symptoms that you're having, and help us use it to actively determine what we think that we can do in terms of the help, the frequency of care that's needed, as well as what the overall recommendations can be based off of your goals and coinciding with some of the other findings that we get.